With a super busy practice, I think the challenges, on the provider side are getting the patients in, getting them scheduled properly, filling up our schedules, having time to spend with the patient.
Leveraging technology to make us more efficient. In medicine now, volume is key. You have to be able to meet those volume expectations. And so having the right people in place to be able to provide the care that we need to the patients in an efficient and safe way.
What pieces of technology as it relates to rendering care are you the most excited by?
I think we're excited about technology in medicine.
So I'm excited about being able to leverage technology to do the things that it doesn't necessarily require a human to do so that our people can focus on taking care of people.
Thanks so much for joining us today from LoneStar Heart and Vascular. We'd love to hear from both of you on how you got started to where you are today. Maybe we'd love to start with you and your background and your story.
Yeah, my name is Jamison Wyatt. I'm an interventional cardiologist. We practice in Central Texas in a town called New Braunfels, Texas. I'm from Central Texas, kind of born and raised in Texas, went to Texas A&M for undergraduate and did most of my medical training there. Came out in practice probably about 13, 14 years ago. Started off in a private group down in Corpus Christi, and shortly thereafter transitioned up to a private group in New Braunfels. And was with that group for probably 5 or 6 years before myself and another partner started our own group, and that's the LoneStar. And so we've been in operation about 5.5 years there.
My name's Kelly Cole. I'm with LoneStar Heart and Vascular. Started as a nurse's aide straight out of high school. Thought that I would be a physician, started down that path. Life had other plans. Ended up with a bachelor's in business. So I've done many different things in the healthcare space. I did IT consulting for quite some time, but it was always from the operations standpoint and helping physicians be physicians and taking some of the burden off of them so that they can focus on the bedside and I can help take care of the problems in their day-to-day.
You mentioned that, most of cardiology and heart and vascular care is rendered in the inpatient, yet you choose to run an outpatient clinic, which is a pretty big minority in the space. Maybe tell us why you chose to do that and a little bit more about that decision.
I think most of the physicians in my specialty are employed by major hospital systems. And so there's not as many private practices out there. And there's advantages. Some people kind of like that employed model where they just don't have the burdens of running a practice, dealing with the revenue cycle, and the HR and all the headaches that come with running their own practice. But some of us really enjoy that and really like the freedom to set up our practice how we choose, to see patients how we want to, and to really not have that employer looking over us all the time.
So today you guys have actually grown quite a bit, right? You started with an individual location. You guys have grown to multiple locations. What has that experience been like? How did you know it was the right time to grow versus, expanding your individual or single clinic you were in? We'd love to hear about that.
Yeah, we started off, so we were actually planning on, there were 3 of us interventionalists that formed this group, and our plan was to stay at 3, maybe a 4th just to cover call a little bit easier, but we never wanted to grow any larger. The area that we're in has been one of the fastest growing areas, top 2 probably in the country for its size in the past 10 years. And so by necessity, we had to grow. And so that idea that we'd just be a small group with small problems went away pretty quickly. And today we have 15 providers, I think, 5 years later.
Wow. Any thoughts on your end?
Go what he says. We're in an area of tremendous growth, and the cardiovascular segment of healthcare is one that everyone needs at some point in their life. And so it would be we'd quickly become irrelevant if we didn't continue to grow.
Yes, it's almost like to survive you have to grow. What's been the hardest part about that? Because that's, in just a couple years, that's like 3-4x.
It's scaling everything, to be able to keep up with the, when we started off, early on, my wife and my other partner's wife were answering the phones at the front desk and helping us schedule. And we had one biller and, we'd work with her every day and, how the clings were going. And, we could survive that way. But very quickly after we added several more providers, those problems all scale up huge, and before you know it, we have 700 phone calls a day coming in. So 2 wives can't keep up. and and then the billing side of things grew to needing 7, 8, 9, 10 billers and a billing manager and all those things. And so really just trying to keep up to grow. We start off with a small medical record system and trying to scale up to something that would accommodate the size of our group for scheduling and imaging, and everything else has been the biggest challenge.
And I think the experience you have is unique in that you're a physician yourself. And are you still practicing on a day-to-day basis?
Oh yeah, full time.
Full-time practicing and full-time CEO of this group. How do you split your time? How do you manage that? That's a pretty unique.
Well, I think we made a good decision a few years back because myself and one of my other partners, Dr. Bose, we were really, we had a kind of a dual role to help manage, and so there was two of us, but we quickly realized that we were running out of time to do one or the other very well, and so we were fortunate to hire some really good people to work with us. Kelly being one of them, Tasha, and then our revenue cycle manager Jennifer have all been key to adding to our business to enable that. Because otherwise, we'd either not be practicing, we'd have to take on a full-time role, or you can really only do one or the other.
Got it. And Kelly, question for you: outside of just revenue growth or clinic growth, what is success, or how do you define success in your day-to-day operations?
Maintaining an environment where our providers can continue to provide excellent quality care without compromising their lifestyle and their work-life balance, if that's even a thing in medicine anymore. But building the systems using technology in a way that allows for smart practice.
And what are you the most excited or interested in, or as you've been keeping up with the trends, like what gets you the most excited to go deploy in your practice?
Leveraging technology to make us more efficient. In medicine now, volume is key. You have to be able to meet those volume expectations, and so using technology, having the right people in place to be able to provide the care that we need to the patients in an efficient and safe way.
For someone that's thinking of starting their own specialty practice, right? And apologies, that meant most groups are affiliated with some sort of inpatient, whether it's hospital or something like that. What are the biggest constraints right now? If someone's listening and they say, hey, I want to go do this as well, right? There's so many upsides to it. What are the things they should keep in mind? And we'd love to hear from both of you on that.
Yeah, I mean, I can speak because I've spoken to a number of physicians that are employed in our area that just would like to reach out, that have, dreams of like being back in practice, that don't like being employed. It's just fear of the unknown. I think they just, I think revenue cycle is very daunting. And I think when it's a whole nother language, and most of us physicians throughout training, and then especially if you go straight from training to an employed role, you never have any experience with that side of things other than occasionally somebody reaching out to you say, hey, can you add this to your documentation so we can collect on that? Or can you sign off on this so we can collect that? That's usually the only experience they have. And so I think, just the financial worry about how they're going to manage that. I mean, that's just one small component of it. I mean, there's a million other things like getting a space and getting an EMR and hiring folks and who's going to run that. And so I think it's just an overwhelming task for most people thinking about, even if they have a group of people to join together to start a practice, it's just financially and professionally very risky, I think, in most people's minds.
And finding the right people to do the things that Dr. Wyatt's talking about, having a team that you trust and can work well with and collaborate with. It takes a little bit of everybody's perspective. It takes everybody, but it's hard to find those people.
Where do you even start? Like, say tomorrow someone was like, hey, I want to go do my own thing. And to your point, you said it's quite daunting. And even as you're listing them off, I'm like, yeah, that is a lot of things to go figure out. Like, how did you, when you did it, you're like, did you just jump into it? Did you know? Did you?
I think we were lucky, because we had some experience already. We were in a private practice. I was a partner in another group. And we certainly didn't have, we were missing about 90% of the knowledge. But even just having the 10% and knowing what we didn't know was very helpful. And I think that's kind of what gave us the energy to do it, or the courage to do it. But I think for most people, they wouldn't even have that 10% to even know where to begin.
Kelly, you talk a lot about, and you mentioned a few times, the type of people you have in your growth is so important. We see the same in organizations like this. That kind of makes or breaks your organization. What are things that you've learned in growing and building your team of the types of people that have worked out really well? Maybe some traits of those people.
I would say patient-centered and being willing to do whatever it takes to take care of that patient. Sometimes it's a lot more difficult than it sounds. Everybody would say, oh, yes, I put the patient first. But sometimes that's very difficult to do because there's a lot of demand, in every role, front desk, medical assistants, nurses, physicians. And so that's one of the questions that I ask in every interview is, what does patient-centered mean to you? You can find out a lot about somebody in that question.
What's a great answer there?
That willingness to do whatever it takes. Mm-hmm. And it sounds different to each person and depending on what their role is, but that exceeding no bounds.
Yeah,
So.
yeah. And it feels like one or two right hires can really supercharge your growth in your bank. Go ahead.
One wrong hire can change your trajectory.
What are, as you think about your day-to-day, right? Specifically in operating your clinics, what are the inefficiencies that you think about or you're going after that are, maybe these are just really big problems to go after, but what are you thinking about on a day-to-day basis that you're attacking?
Yeah, that's a big question because there's so many of them. I mean, at least where we're at, with the super busy practice, I think the challenges, on the provider side are getting the patients in, getting them scheduled properly, filling up our schedules, having time to spend with the patient, to where you feel like, the patient has 15-minute visit. I think a lot of times you're like, I have 3 minutes to spend with them because I have 12 minutes of other things I have to do. And like trying to reverse that, you're like, really, I would like to spend, 13 or 12 or 13 minutes of that visit talking to the patient and 3 minutes doing the other things I need to do. And so I think that's one of the biggest challenges. Getting that, and then from the time you walk out of the office, getting everything done for that patient that they need so that you can do what you set out to do for them. Like, I need to have this test done. I need you to do this. You need education on this. And then making sure that that's all done when you follow back up with them so that you can go over it and be productive on the next visit. And I think those are all major challenges.
What have been some processes you've optimized that have directly impacted your margin? So what are things that you've said, like, this is our big project for the year, and you saw the downstream impacts of that?
Well, our revenue cycle is incredible. Our Jennifer, who oversees our entire revenue cycle, she knows what each individual does on her team down, to the very basic units. She's very, very good at helping them to be efficient. Unfortunately, a lot of our processes are very manual, but she's built a team that can accommodate those manual processes. So next steps would be making it more efficient.
Got it. That makes sense. And then what about for you two being, say, the two core leaders that run the clinic? What metrics are you looking at every single week? And if you're like, hey, this metric is in the red, you have to go personally, address that.
Yeah, I think every week we sit down and like there's several metrics. We look at operations and revenue cycle metrics, but we're always looking at, of course, our charges, our collections, schedule utilization, the numbers of images and imaging studies that we're doing, office visits, provider utilization. And so we look at those every week, and I guess those are kind of our key indicators for that we have to stay on. Is anything falling behind? Why are time of service collections down this week? What happened? Do we lose somebody up front? And just trying to stay on top of those so it doesn't become like a 3-month problem.
And then what about on the clinical side? What are you focused on the clinic? Because those are more, call it rev cycle collection metrics, but on the clinical side, what are you looking at?
That's one of our challenges is the lack of visibility into clinical metrics, just because of the inefficiencies in our technology. So
got it. That makes sense. If we take a step back and just think about the industry, where do you see care moving to over the next couple of years, and what pieces of technology as it relates to rendering care are you the most excited by?
I think I'm pretty excited about the possibilities of what AI is going to bring to our space. Medicine traditionally we're so backwards on adopting technology. Today I don't know how long ago medical records went electronic. I was in probably medical school or fellowship. I remember still having all paper orders, printing out the radiographs and everything. At some point we went to electronic records, but they were just really electronic filing cabinets because none of them communicated to any other office. Even today, if I request a record from the hospital or one of the other providers in town, they are literally faxing it over, and we are printing that out or in some form, and scanning that into our record, even if it comes over electronic. We're still having to like manually put that in our record, and that's how we get patient records. And I'm excited about, obviously the AI scribe technology is amazing, but even what can go beyond that with AI assistants, I just see an AI assistant following me around to where, not only are they scribing the record, but they're generating orders and printing out or emailing the patient recommendation. I say, hey, you need to follow Mediterranean diet. Before the patient gets home, they already have an email with, or something in their portal linking them to the Mediterranean diet and information they need. They need orders before they leave. They have the order for an echocardiogram completed. It's already scheduled, and all this kind of streamlining that process so that it's not 50,000 manual steps with 50,000 places that it can get dropped. And I think is where I'm excited about technology in medicine.
And, I talk a lot about having the right people at the table. A long time ago, having the right person meant that they made patients feel good, that they had good customer service skills, that they were dependable, and all of those things that feel good. Now we have to require all of our people to have all of those skills, but they also have to be very highly attentive to detail and be very knowledgeable about some of the intricacies that these payers require. It's what it comes down to. It's just fighting for the dollars. So I'm excited about being able to leverage technology to do the things that it doesn't necessarily require a human to do, so that our people can focus on taking care of people.
Yeah. And I can imagine that leads to just much more satisfaction in the role as well, and retention and, ability to work on things that people want to work on as well, and be patient facing and not administrative facing. We think about that a lot as well, and definitely resonate with that point. One question on the financial side: how are you guys thinking about private equity as it relates to the cardiology space? And are you seeing roll-ups? Are you seeing folks come in? Are you seeing folks enter? What has been your read on the private equity market?
A lot of the practices that were independent out there throughout the country, that they've gone to private. A lot of them have been purchased by private equity. I had major concerns about just having another player in that, another hand in the cookie jar, if you will, and like what they actually bring to the table as opposed to what they're taking away, and what that's going to look like, 3-5 years down the road. Because it seems like the experience, that concerned about what happens in those practices, 3 or 4 years down the road after they've been there, and and what they're really, private equity. They're there to make money for their clients, but not necessarily with an intent on providing good service for patients or making providers' lives better. So what I've seen and concerns I have with it.
And has there been a lot of activity in the Texas region that you guys are seeing, or is this more nationwide? Or curious to hear.
Yeah, I think there's been a lot of practices, especially I've seen a lot of private practices even in our town that have moved to private equity. Certainly in the region, down in Houston, and have a lot of friends down there, so I hear a lot about that area. But yeah, a lot of private equity activity, purchasing practices over the past decade.
And so how can, because clearly that's not the patient experience that you want, what can practices do to stay independent?
I think we're going to have to get creative about reducing our costs, about, reimbursement isn't going up every year. It tends to go one way for us. I don't remember the last time we had a cost of living adjustment for Medicare for physicians. So we have to keep that in mind. And so I think we have to get smarter about how we practice, and trying to maintain the patient experience, like you mentioned, and if not even make it better, without driving ourselves, without running out of business, driving ourselves out of business.
Yeah. What do you expect? Do you think it's the rev cycle? Is it some other part of the business? Because you said yourself, you have to get more effective, or you have to get just more operationally sound over the next little bit. Where do you think that comes from? Right? Because to your point, the Medicare reimbursement has been cut, I think, every year for the last, I don't even know how many years at this point, right?
I think it comes from everything. I think it's from your efficiency, from our staff utilization to controlling our expenses, to maximizing our collections, or obviously the revenue cycle is very important. And I think that's where a lot of private practices fall short. Is it's just very difficult, and you have finding the right people to manage that is hard, and so you lose a lot on the back end that you should have collected. And then the controlling expenses are kind of the two major areas. I think most physicians are good at, these practices are good at working hard. They go out and they see the patients, and they're just working to death, seeing as many patients as they can, but that doesn't always, equate into a solvent practice.
I would echo that. I would say that you have to keep that customer experience in mind, because patients are consumers and they do have a choice. And so being efficient, getting them in fast, because that's the expectation, so that you keep your referral patterns. Those are the focuses on the practice operations, but not in a way that makes it so demanding on your physicians that they can't maintain it. Because like Dr. Wyatt said, they're willing to work really hard, but you don't want to burn them out either. So you have to find a way for them to see higher volumes without making it too taxing.
Yeah. How do you think about, because I think a lot of that comes down to how you schedule, right? And the types of patients you take. And how do you think about optimizing that? Because that's a tough problem. We were speaking about it earlier today. That's a tough problem to optimize. How do you think about that?
That is a weekly, daily conversation with us. We talk about it constantly, trying to get the schedules optimized. And I think it's a living, breathing document. A schedule is you never solve that problem. And just when you think you've got it right, something changes with a type of patient or a new referral source or something that changes it. So I think you have to be flexible and know that you're never going to arrive.
Yeah, the same thing. I mean, we work, like, I think of the front desk, of people who answer the phone when patients call. And, there's two problems. One, there's too many calls. There's just not enough people to answer the phone sometimes. And so patient access to a person to get the message that they're trying to relay to us relayed. And then the person sitting there, about the time you get them trained, they may move on to some other job, or they get a promotion, or something comes up, and then you have a new person sitting there, and you're starting over, trying to teach them the 1 million rules, if you will, that they need to know to be able to schedule patients when they do call. And there's a million of those tasks. That's just one aspect, scheduling, but all the way through our practice, those are the same. I feel like those are the same challenges we face. It's just there's too many tasks to be done, and then having the right people that can do it consistently is a problem.
How do you protect yourself against some of that knowledge transfer? Because there are certain roles that are just much higher turnover, and not just for you guys, I'm sure across the industry, right? How do you, any strategies or any things that are worth mentioning?
I think we are constantly working to refine our documentation so that there's good reference tools for staff. That onboarding and training is so important, and realizing that everybody learns in a different way and at a different speed, and trying to meet them where they are. It's challenging, but I think you observe and adapt as you're training.
Yeah. I think most businesses see that as one of the core issues, right? That they have to solve to be able to scale, or to be able to your point, optimize the different parts of your business. I'm curious, if we think about the inverse, what are things that you guys learned early on that practices shouldn't do, that maybe they spend too much time doing, right? Or they spend, maybe some mistakes you've made that you've learned from, where you're like, hey, I probably shouldn't have done this. Many stories or piece of advice?
I'm sure we've done a million things wrong that we've learned from. Yeah, I think we've been fortunate not to make too many giant mistakes, or else we wouldn't still be in practice. But yeah, I think that the list is endless of things that we've learned from.
You have to pay incredible attention to the requirements of the payers, because you can do a lot of work and not get paid for it. And so, those are sort of learned by trial and error. But as you really have to appreciate the detail and complexity of the payer requirements to get prior authorizations and to do this. We're unique in that we have our clinic, our outpatient clinic, ambulatory clinic. We have our imaging center, and then we have our procedure suite where we do in-office procedures. And so every layer of those, patient could interface with all three and frequently in a short period of time. And we have to make sure that we know exactly what the payer is going to require from us as they move through the different parts of our practice.
Right. And it's an ever evolving, set of policies, and the payers are getting smarter, like we were talking about earlier, right? They are using all these advances in technology as well. So
Yeah, they're way ahead of us
yeah, it just makes it
on
tough
ways
to
to
keep
deny
up.
the claims. I mean, that's just the. I mean, I think it's just a. If I was on that side, I mean, what would your strategy be? I think you just have to think about what their strategy is to not, you know, the less they pay out, the more they make, and so they're obviously going to have strategies within the rules of their system to try to maximize that.
A few final questions. As you think about your future expansion, right, and your growth, like where do you guys want to be in the next couple years? Like, what does success look like for you?
Yeah, I think that's come a long ways from our 3 physician model that I mentioned, where we were just going to stay small. I think it's turned into something a little bit different, and I hope to be able to offer other physicians the same opportunity to kind of practice independently if they want, and I'd like to see more physicians that are not employed and that are guiding their own practices. And I think one thing we're looking at is how can we scale the success we've had to be able to, if not just give a playbook, but also assist other groups in other areas to form a successful practice without having to go through all those trials and tribulation and worry about the financial risk and some of those other things that are preventing them from coming out into private practice. And so I think that's actually where I see ourselves going is potentially scaling our model, likely locally to begin with, but I'm hoping that something that could be scaled anywhere.
That's incredible. And how do you think about the buy versus build model? Because you guys are at a point where you could actually do either, right? And it's just a matter of how do you think about that decision?
As far as like buy versus build,
As in your expansion, right? You could do a series of small acquisitions to grow yourselves, or you could grow de novo, right? Curious, have you thought about that at all?
Yeah, I think that probably absorbing or helping to, for us, there's not as many opportunities out there to purchase or to buy, other practices out there, or are we looking for that? I think we'd be looking for people that would want to do what we're doing, and somehow we would enable them, expand our model to their area. So more of a build probably process with willing partners that that we could kind of put out there as kind of their own pods if they wanted to do that.
Love it. And we've seen, I think, so many great stories of folks that, have started off with, to your point, single clinics and now are running 50, 100, 200 clinic organizations that just compound over 20, 30, 40 years. And it's just an incredible business model. So kudos and hats off to all the success that you've had. And thanks so much for joining us today.